Regularly scheduled weekly COVID briefing with LA County Public Health Director Barbara Ferrer did not happen today. Otherwise, I would have been there as usual. Officials say it didn't happen today because of a scheduling conflict. This comes a day after the chair of the LA County Board of Supervisors, Janice Hahn, joined us here at 6 o'clock and answered if she still has confidence in Dr. Ferrer leading the department.
Does Dr. Barbara Ferrer still have your confidence as the head of LA County Public Health?
At this point, she's still our director of public health, but I do feel like over the years it's been tough, and I think she did lose some trust from our public.
Okay, to talk more about this, we are joined by board-certified ER doctor Michael Daignault. Thank you so much for being here.
Hi.
You, of course, have been on the front lines of the pandemic since the start of the pandemic. What has your working relationship been like with the LA County Department of Public Health?
I think the biggest lesson learned in the course of the pandemic was the importance of collaboration between local and national public health department and frontline doctors, ER doctors, ICU doctors, to provide that important context to the daily reporting of infections, hospitalizations, and deaths. So early on, their experience of reporting those numbers mirrored what we saw in the emergency room and the hospital and being overwhelmed. But over the last year, that situation has changed. It's become much more nuanced. And I think the public would have appreciated having that context to sort of guide them through how the emergency stage of the pandemic evolved and ended over the last year.
All right, and you put out a tweet that got some attention, put it up on the screen. 60 patients, 0 COVID. We obviously know that COVID is still out there, but is this sort of situation sort of more the norm these days?
Yeah, I think this tweet was very emblematic of what I've seen in the last, 6 months to a year. I mean, this was over the course of 3 shifts over long weekends, 60+ patients, and this is when we were still required to test every hospitalization for COVID, and I just didn't see it. I didn't see it in patients walking into the ER. I didn't see any positive tests on people being admitted, and it just goes to show you the context and how things have changed so much in the last few months.
Well, there has been a change because I did get confirmation from the LA County Department of Health Services that oversees major hospitals, including the biggest one here in the county, LAUSC Medical Center, saying that they're going to update their guidance where it's no longer required to test every hospital admissions. What will that mean for overall hospital numbers?
I mean, I think this is such an important step for hospitals to move on from the emergency stage of the pandemic, and for 2 reasons. Number one, it puts the decision-making capacity back in the hands of doctors for us to determine, is a COVID test clinically necessary? Do I think it's causing this patient's reason for admission? Is it contributing to their symptoms? And then number two, I think we're going to see much more accurate accounting of COVID hospitalizations and deaths because we're not required to test every admission anymore.
So essentially, COVID is becoming a little bit more like a cold, right? And not something that needs to be hospitalized, something we're going to live with for a long time.
And this will help with the with and for debate.
Absolutely.
Right.
I think it'll be much more easier to determine what's going on.
Yeah.
All right, doctor. Great to see you. We really appreciate it.
Thank you.